Okay, Tori asks, do you treat conditions other than neuromusculoskeletal problems? Well, of course, it depends on what you mean by condition. I assume you mean painful conditions. Basically, we do one thing in the chiropractic office, and that is to correct vertebral subluxations. And vertebral subluxations are when the joints don't function as well as they should. So these joints, their job is to move. And if they don't move freely, if they get locked up because the muscles, those tiny little muscles that go from one bone to the other, they lock up, and they're basically there for stability to protect the joint from being dislocated. They do a little bit of fine tuning, but it's usually the bigger, more superficial muscles that do most of the motion in your spine. But when these lock up, when these tighten up, and then the ligaments below them actually shorten, they don't allow for normal motion. And when that happens, then it can affect the nerve root. And these nerve roots go to different places in the body. And when you've got 31 pairs of them coming out from between the openings in the spine on both sides, then you can have a problem anywhere in the body because you're going to get irritation being caused by that vertebra not functioning properly. So basically what we do is we try to normalize the body by adjusting the spine. The reason it's so effective with pain is because pain is caused by pressure or inflammation. When you get that pressure removed and you get some joint motion back, then eventually the inflammation will go away, and that will cause the pain nerves to go below their threshold. In other words, you need a certain amount of stimulation for one of those nerve endings, they're called nociceptors, to fire. And if you're below that threshold, and they have a threshold because if they didn't have a threshold, there's so many of them, everything would hurt all the time. So there has to be enough pressure and enough inflammation. So when people come in, they go to the chiropractor and they say, you know, I got an adjustment and it corrected my problem. My pain went away after an adjustment or 2 adjustments or 3. That's usually because the whole problem was caused by that pressure. Now, sometimes you don't realize that pressure is there and it can go on for weeks or months, and unfortunately, that's going to cause some degenerative changes to occur if it's there for a long enough time. So sometimes it's better to have the pain. So we get the joint functioning again, get the pressure off the nerve, the pain goes away. So now that can affect the nerve root. So the sciatica goes away, the numbness in the fingers and hands go away, and much less reliably, this is mostly stories told by patients, but millions of patients over the years, they talk about how problems in their breathing and their digestion and various problems went away when they got chiropractic adjustments. Now, I never tell that to people. I don't charge people for that because I don't know. It's not reliable. This is an old story that goes back 125 years to the origins of chiropractic, when Daniel David Palmer claimed to have cured a deaf man who had been deaf for 17 years because he felt something pop somewhere in his spine, and Palmer popped it back, and that was the beginning of the profession because his hearing came back, which, by the way, that happened to a colleague of mine in the 1980s. He had a patient who was deaf in one ear. This was back when I was practicing in New York City. He practiced down the block from me. He called me up all excited because he did an adjustment of her neck because he had neck pain, and she said her hearing came back immediately. So there are all these connections that are not understood anymore, yet, I should say, because back when I was in chiropractic college, for instance, which was over 40 years ago, they told us, and all the textbook said that you couldn't have back pain or neck pain because of a disc, because discs don't have any nerve endings. Well, they found that the outer 1/3 of the disc is full of pain nerve endings. So things are being discovered all the time. Of course, you need to have the research. You need a lot of money for the research. So our profession has had to be satisfied with getting research from other sources to back up some of the things that we do. But there's definitely an effect on the body in general from having your spine functioning properly. I mean, your level of mobility, your skills in athletic events, all those kinds of things will improve as your spinal motion improves.